All right, for anesthesia, when we are coding for the anesthesia, this is the guidelines that we will follow for anesthesia coding. Now, I want to let y'all know, if you're using the index to find the location and procedure, you're supposed to find the procedure and location in that order. So wherever you at, if it's anesthesia, you going back there to the back. You need to know which one of these is the procedure, right? And then you need to know the location. So, for example, let me show you. If we going to the neck, we will be going to 00300 to 00352. That's on page 70. There you go. You see it? And this is how you look up things. But I'm going to tell you something. Because I know my book now, I didn't have to highlight the things that I needed to. But let me show you, okay? All right, so this is what you will highlight for the neck when you're coding for anesthesia. You're going to make sure you highlight the muscle and nerves of the head, neck, and posterior trunk. Okay? Alright, so let me show you how to do this one. Alright, so we highlighted 00320, and it starts with the esophagus, thyroid, trachea, and lymphatic system of neck, right? And it's for age 1 year or older, okay? So again, you don't have to write all those notes on the side. You don't have to do a lot of highlighting, boxing, circling. You don't have to do all that, because in the code, it actually tells you what it's for. It tells you the age range. Do not put all this extra stuff on here, because when it comes time to take your test, it will confuse you. You only have 2 minutes for each question, okay? For a 100-question test, you got 2 minutes. And they only giving you 4 hours. You have to come up with a better way of test taking, okay? The way I did these two, that is how you will go in and you will study each section of your book. You have to go through each code and actually highlight what it's regarding to. Because if not, you're going to be wasting time trying to find out what is what on the test. Or trying to use your index, trying to figure out where to head to. A lot of times on the test, it will confuse you. It will put the same codes up there, and you know what? Oh, let me show you. So speaking of that, even though they put the same code up there, they might have these on here. You must know when an anesthesia physician is coding, it's AA, okay? That is the sequence coding for the AA. When a CRNA is coding for the anesthesiologist, it's QX and QZ, okay? This mean without. This mean with. So y'all make sure y'all take these notes down, okay? I'm going to leave it right here for a second for y'all. Make sure you are reporting MAC, CMS, and other insurances. These are monitored, okay? You need to make sure you're writing this down, because they're going to ask you that. You need to know about the local anesthesia, general anesthesia, and regional. You need to know the difference between it. You need to break it down. I put some key terms up here a little bit, because they're going to ask you about that. Normally when you're dealing with anesthesia codes on the test, they're going to ask you about supervision, direction, and being monitored. Anesthesia is based off time sometimes, so they're going to ask you about the time frame, whether that patient was in there under anesthesia for an hour and 15 minutes, 2 hours, however it go. You have to put that time with it, okay? It's important. I'm going to go back to the front. It's important for you to read your anesthesia guidelines, okay? Please read your guidelines. As you can see, I highlighted my physical status modifiers as well, because this relates to the health of the patient, okay? This relates to the health of the patient. You need to know this. This is important as well, the qualifying circumstances. Again, if my voice sounded muffled, I am sick, but I'm here trying to show you how to code. So right here, this code, they normally, hold on, my camera. Right here would say 99-100. You use this code separately from the primary anesthesia procedure, okay? But this is only for a patient that is of an extreme age of younger than 1 year old and older than 70, okay? But it got to be used on one of these. For procedures formed on infants younger than 1 year old of age at the time of surgery, you see 00326, 00561, 00834, and 00836. You see it there. Get it. All right, now, not going to hold it long. These are my notes. This is how you would code it. Make sure that you capture this moment at the back, because you're going to need all that information to determine whether or not if your code is going to be right, okay? Let me know your questions if you have any.